Hello, my name is Charles Saldana, and I'll be discussing the unethical practices that occurred in the Willowbrook State School for Mentally Disabled Children in Staten Island, New York. The school was built to take in up to 4,000 kids, but the maximum capacity was exceeded by more than 6,000. With the growing population of incoming students and the decline in staff, the living conditions became unbearable, and the children were often neglected, treated harshly, and on top of all this, they were deliberately exposed to the virus that caused hepatitis for research purposes. To understand how these medical researchers were able to carry on with their unethical procedures, it's worth noting that Willowbrook State School was known for its outbreaks of hepatitis throughout its first 10 years after being opened in 1947. And as previously mentioned, this was mostly due to the overcrowding and unsanitary living conditions at the school. The school started to become a research site in 1956 when medical researchers understood that the overcrowding and the poor health standards of a school packed with children unable to make informed decisions would make for an easier population to test on. The reason this large and vulnerable population was so easily accessible for testing was because that at the time the school was built, there was a stigma on the mentally disabled where society had viewed them as a burden and incapable of being included into the community. So institutions like Willowbrook State were built to segregate them all into one location, even when the initial status quo was to educate, train, and provide the proper care that they needed. The hepatitis outbreaks in the school triggered the initiation of testing of the virus that caused the disease among children, and this was done by medical staff Saul Krugman of New York University and Robert W. McCollum of Yale. In their research, they attempted to understand how the virus spread, if it could be prevented, and how many types of viruses cause the disease. In their research at the time, both men discovered that hepatitis can be spread through blood transfusions and directly from person to person through the oral fecal route. This was done by injecting children with the virus or feeding them feces, urine, or blood infected with the hepatitis virus and analyzing their effects. Krugman would watch as their eyes and skin turned yellow, as their livers got bigger, and he'd watch them vomit and reject food. And in the end, Krugman's reasoning for their unethical and inhumane practices would be that the children were already vulnerable in contracting hepatitis even without inoculation. And to make matters worse, the medical researchers knew that this population of children didn't have the mental capacity to understand, decide, and give their informed consent. Furthermore, if consent was received, it was given by their parents who were vaguely informed about the risks, benefits, and nature of the procedure. So, in the end, the children were not only taken advantage of, but the parents were also deceived. In his experimentation with hepatitis, Saul Krugman had violated 3 of the 5 principles of medical ethics. These would be autonomy, beneficence, and non-maleficence. Autonomy was violated when Krugman had involuntarily given the virus to the children without their consent. Beneficence was violated when Krugman deliberately put the children in a harmful condition when he inoculated them with the virus instead of trying to reduce the difficulty of their lives with the mental disability. Non-maleficence was violated when the children were exposed to the infectious disease without consideration of their well-being or an immediate treatment available, ultimately leading to the long-term negative effects of the virus. After the Willowbrook school experiments had taken place, there was a lot of emphasis placed on the deinstitutionalization of large institutions that housed the mentally disabled. The Willowbrook incident had clearly represented how often the developmentally disabled were neglected, mistreated, and ignored. Therefore, community-based care and a shift towards disabled people's rights were advocated for. This change was made possible with the help from investigative reporter Geraldo Rivera and his exposure on the chaotic living conditions of the Willowbrook State School. The unethical practices carried out by Krugman were also exposed, and naturally, the people felt betrayed, having been lied to by the medical community, and it brought distrust to any further research projects for medical advancement brought by the researchers. As a result, ethics committees like the institutional review boards were created so that ethics would be aggressively applied to research projects that involved human test subjects or vulnerable populations. As of now, I'd like to believe that these types of ethical protocols are applied to every aspect of medical research. I would say that it's important to understand unethical research practices as a studying dental hygiene student because it gets us ready and aware for making ethical decisions when we're in the real world. An example would be always keeping the patient's safety and well-being in mind. Dental hygienists work closely with patients in education, preventive care, and cleaning. And even though the ideal hygienist would advocate for what's best for the patient, it may slip past their mind that in the process of care, they may end up implementing too much fluoride varnish on their patient, believing that more would help strengthen the tooth enamel. Unfortunately, this isn't the case, and exposing the patient to too much fluoride varnish could cause dental fluorosis and essentially discolor the patient's teeth. With that said, it's important for the hygienist to be up to date with the current research and be aware of not overusing certain treatments and prevent doing more harm than good for the patient. Being aware of unethical research practices would help me in the future by keeping me covered from any potential lawsuits and attending my patients with their well-being in mind and therefore promoting trust in the profession.